In this video, we are going to talk about intermittent catheterization, which is also called straight or self-catheterization, and what this looks like if you are a male. The learning objectives are listed above. We will discuss needed supplies, steps to follow, tips for your caregivers to help assist, and when you should call your doctor. To start out, here are some supplies you would need. Of course, here's your catheter. It's usually a clear or red rubber tube. And you also might need something called a catheter extension tube, but that's optional for you. You also need some way to collect the urine. So pictured here is the catheter bag. This could also just be any kind of container like a jug, bottle, or urinal. It can even attach to the side of a bed, chair, or wheelchair, or it could just be held in between your legs as well. A sterile drape or the absorption pad are both optional. This can just help to keep the area clean and have less cleanup afterwards. One item that is not pictured here, but we highly recommend you use, is some kind of water-soluble lubricant, such as KY jelly or Surgilube, but do not use Vaseline. Here are your step-by-step directions to catheterize yourself. You can catheterize yourself while sitting on the toilet, in a wheelchair, in bed, or while standing. Be sure to wash your hands well with soap and water or use an alcohol-based hand sanitizer. Wash the end of your penis well with soap and water. If you are not circumcised, be sure to pull back the foreskin and keep it back during the procedure. Take the catheter out of the plastic bag. Put a small amount of lubricant on the tip and about 2 inches up the catheter. In one hand, you'll hold the catheter about 1 inch from the lubricated tip. With the other hand, hold your penis away from your body. Now you can gently put the catheter into the urinary opening, also called the urethra. Once you reach about 6 inches into the urethra, then there is a ring of muscle tissue that the catheter must pass through. At this point, it might be a little harder to pass the catheter. Take a deep breath and gently apply steady pressure. The catheter should pass into the bladder. Never use force to pass the catheter. If you are not able to pass the catheter without using force, stop and call your doctor. Continue to put the catheter in until urine flows out. Then insert it another 1 to 2 inches. Let the urine flow into the urine container or into the toilet. An extension tube attached to the end of your catheter will give you the extra tubing needed to reach the toilet from a wheelchair. Slowly begin pulling the catheter out. Stop pulling the catheter out anytime that urine starts to flow again. Again, take some deep breaths or press on your lower abdomen. Repeat this step until the urine completely stops. If you are a caregiver who catheterizes someone else, then you would follow the same process described. Have a doctor or nurse walk you through the steps and ask questions about anything you don't understand. Wash your hands before and after and keep all of the supplies clean to prevent infection. Watch for any signs of infection and ask the person if they have pain or discomfort during the process. Call your doctor if you're having any problems or see these signs of infection. Cloudy or foul-smelling urine, chills or fever, leaking urine in between catheterization if this is not normal for you, not feeling well or feeling tired or weak, pain or tenderness across the lower back, increased muscle or bladder spasms, red or swollen urinary opening, or if you're not able to pass the catheter through to the bladder. If you have any more questions or concerns about how to complete self-catheterization, then please reach out to your medical team.